The home health nurse visits the home of a patient who has just been discharged from the hospital after a small bowel resection. Which of the following patient statements concerns the nurse? A. I enjoy eating cornbread with my dinner. B. I drink a lot of apple juice. C. I make my sandwiches with white bread and smoked turkey. D. I limit the amount of milk I drink to 1 glass each day with breakfast. E. I have stopped drinking coffee every day. The answer is A. I enjoy eating cornbread with my dinner. Patients recovering from lower bowel surgery, such as small bowel resection, must adhere to a low residue diet to minimize intestinal activity. A low residue diet includes white breads, cereals, and pastas, well-cooked vegetables without skins, fresh fruits without peels or seeds, tender and well-cooked meats, limited dairy, meat broths and strained soups, and clear juices. The patient must avoid high residue foods, including whole grain breads such as cornbread, strong cheeses and yogurt, raw vegetables, dried fruits or legumes, juices with pulp, coffee or other caffeinated beverages, popcorn, nuts, and seeds. Which of these is a proper lifestyle change to fight gastroesophageal reflux disease, GERD? A. Cessation of soda intake. B. Decreasing fluid intake. C. Eating acidic foods. D. Increasing spicy food intake. E. Eating meals less than 1 hour before bedtime. The answer is A. Cessation of soda intake. Soda intake exacerbates symptoms of GERD. Along with this, individuals should wear loose clothing, exercise regularly, drink plenty of fluids, avoid eating within 1 to 2 hours of bedtime, and avoid spicy and acidic foods. A nurse is counseling a 60-year-old woman who recently found out that she has chronic hepatitis C. She is not sure how she became infected, though she does state that she had a blood transfusion in 1989 due to postpartum hemorrhage. She is concerned about the stigma of the disease and wonders how common it is in the United States. The nurse informs her of which of the following? A. Hepatitis C is the most common chronic blood-borne infection in the U.S. 3.9 million Americans have had or are currently infected with the virus. B. Hepatitis C is the third most common chronic blood-borne infection in the U.S. 2 million Americans have had or are currently infected with the virus. C. Hepatitis C is a rare infection. There are currently approximately 30,000 people in the United States living with this disease. D. Hepatitis C is not particularly common. Approximately 300,000 people in the United States have a current or past infection with the virus. The answer is A. Hepatitis C is the most common chronic blood-borne infection in the U.S. 3.9 million Americans have had or are currently infected with the virus. Hepatitis C is the most common chronic blood-borne infection in the U.S. Approximately 3.9 million Americans have antibodies against the virus. Of those, approximately 70%, 2.7 million, have chronic hepatitis C infections. Most pituitary adenomas are non-functional, incidentalomas. Of the functional adenomas, which are the most common? A. Null cell adenoma. B. Prolactinomas. C. Gonadotrophic adenomas. D. Somatotrophic adenomas. The answer is B. Prolactinomas. Prolactinomas, prolactin secreting, make up 30% of functional pituitary adenomas. The second most common type are somatotrophic, growth hormone secreting, adenomas, which make up 15%, followed by gonadotrophic, gonadotrophin releasing, adenomas, which make up 10% of reported cases. Null cell adenomas are non-functional, they do not secrete hormones. Which of the following are common cardiac signs with hyperthyroidism? A. High cardiac output, tachycardia, and atrial fibrillation. B. Diastolic murmurs and low cardiac output. C. Atrial stenosis and tachycardia. D. Premature ventricular contractions and low cardiac output. The answer is A. High cardiac output, tachycardia, and atrial fibrillation. A cardiac workup on a patient with hyperthyroidism will often reveal high cardiac output, tachycardia, atrial fibrillation, a prominent, fourth heart sound, S4, and full murmurs. This condition is not associated with low cardiac output, and while it may be seen with murmurs, it is not specifically associated with atrial stenosis. What HbA1c level is diagnostic for type 2 diabetes? A. Greater than 6.5%. B. Greater than 5.7%. C. Greater than 6.3%. D. Greater than 7.0%. The answer is A. Greater than 6.5%. A hemoglobin A1c level of 6.5% or greater is considered diagnostic of type 2 diabetes. A HbA1c level of less than 6.5% does not exclude a diagnosis of diabetes, however, and should be looked at alongside fasting blood glucose and oral glucose tolerance testing. What is the most common cause of hyperthyroidism? A. Hashimoto's thyroiditis. B. Toxic nodular goiter. C. Graves' disease. D. Thyroid storm. The answer is C. Graves' disease. Graves' disease is the most common cause of hyperthyroidism. Graves' disease is an autoimmune condition in which antibody is produced against the thyroid-stimulating hormone, TSH, receptor, which binds to receptors, resulting in continuous stimulation of the gland to synthesize and secrete excess quantities of the thyroid hormones T4 and T3. Thyroid storm and toxic nodular goiter are less common causes of elevated thyroid hormone levels. Hashimoto's thyroiditis is the most common cause of hypothyroidism. What is the most common sign of primary hyperparathyroidism? A. Elevated serum phosphorus. B. Depressed serum calcium. C. Elevated serum calcium. D. Depressed serum potassium. The answer is C. Elevated serum calcium. The most common manifestation of primary hyperparathyroidism is elevated serum calcium. Parathyroid hormone, PTH, activates osteoclasts, which mobilize calcium and phosphate from bone. PTH also increases renal tubular absorption of calcium and inhibits the reabsorption of phosphate, resulting in elevated blood calcium levels while maintaining normal phosphate levels. High PTH has no significant direct effect on potassium levels. A male client presents to the outpatient clinic for care for recently diagnosed hyperparathyroidism. He has been undergoing care for this condition. The nurse recognizes this patient will be at risk for several clinical manifestations. All of the following are signs and symptoms associated with hyperparathyroidism except dash. A. Skeletal pain and backaches. B. Painful muscle cramps and tremors. C. Delirium and confusion. D. Kidney stones and urinary tract infections. E. Shortened QT interval on ECG. The answer is B. Painful muscle cramps and tremors. Painful muscle cramps and tremors are associated with low calcium levels, which is indicative of hypoparathyroidism. All the other choices are associated with high calcium levels and therefore are symptoms associated with hyperparathyroidism. A 35-year-old male client presents to the emergency department after wife found him unresponsive at home. The wife informs the nurse her husband is a diabetic, and had not taken his insulin for the past 2 days. The client appears flushed, breathing is rapid and deep, and has a fruity smell on the breath. The nurse suspects this presentation is diabetic ketoacidosis, which diagnostic finding would confirm this pathology. A. Elevated blood urea nitrogen, BUN. B. Serum bicarbonate of 23 milliequivalents per liter. C. Blood glucose 450 mg per deciliter. D. Decreased serum osmolality. E. Blood pH of 7.26. The answer is E. Blood pH of 7.26. The acidic pH is what is most consistent with the diagnosis of diabetic ketoacidosis, DKA. A pH of less than 7.30 is what is seen in DKA. The blood glucose will be elevated, but the nurse may also see a similar elevation in hyperosmolar hyperglycemic syndrome as well. The serum bicarbonate will be low and the serum osmolality would be elevated, yet both findings are not specific for DKA. Elevated BUN, blood urea nitrogen, is not specific for DKA as well.